Hello everyone. I am Dr. Tamara Lazić, a board-certified dermatologist practicing out of New York City. I'm going to try to connect my guest. Give me 1 second. I can't wait to introduce you to my guest, Dr. Gorana Kuka. Just sending her an invite now. While we're waiting for her, I want to say Happy New Year to everyone. Happy holidays, whatever holidays you might be celebrating, Christmas and all. I know we're going to have people joining from all sorts of countries. I see people from the US. I see people from Belgrade and Serbia. Ćao, srećna Nova godina svima. I can't wait to introduce you to Dr. Gorana Kuka. She is a dear friend and a colleague. We went to high school together back in Belgrade. She is a plastic surgeon and a hair restoration surgeon who practices out of Miami, Florida, as well as owns the Hair Center Serbia in Belgrade, which specializes in hair restoration. Let me just see if, here we go. She is joining us. Oh, it says she's unable to join. Let's try again. Let's see. Okay, let's see if that works. And while we're waiting for her to join, feel free to send me your questions in comments. And after our discussion or during the discussion, we'll see how it goes. We will do our best to answer as many questions as we can. Let's see. Looks like Dr. Kuka is trying to join, but Instagram is not letting her join for some reason. Let's see. Okay, there she is. Hello. I was starting to lose hope here. I'm glad it worked.
There we go.
Okay, so here she is. I just made a brief introduction of you. Dr. Kuka is my friend and colleague, who, again, for those of you who are joining now, practices out of Miami, Florida, as well as owns the Hair Center Serbia in Belgrade. I gave a brief intro about you, but I'll add a little bit more other than your clinical work as a hair restoration and a plastic surgeon. Gorana is the director of the research of the Foundation of Hair Restoration in Miami, Florida, as well as the co-director of the Women's Center for Hair Loss. Dr. Kuka is recognized for her expertise in hair restoration techniques and her interest in newer, more effective ways of treating hair loss, including investigative work with the FDA on fat and stem cell therapy. I could keep going with Dr. Kuka's credentials, but we want to make this as informal as possible and just have a nice Sunday morning chat. I see you have your coffee or tea or whatever you have there. I have mine too. So the reason why I wanted to talk to you, Dr. Kuka, is because this is, COVID. We're having another wave of COVID. I just got over it. I would say last week is when it all ended for me. And I'm anticipating possibly getting some hair loss. I've been seeing this since the pandemic started, at least with the previous variants of COVID, a lot of patients coming in with hair shedding, which happens a few weeks to a few months, I would say on average 2 to 3 months after having COVID. And it's been quite impressive and debilitating for patients. Our hands have been kind of tied as dermatologists and hair experts because we get to a point where there's not much we can do. So the question is there anything that I can, and people who have just had COVID, is there anything we can do to minimize the hair shedding that might be coming our way? Or if it happens, is there anything we can do to treat, whether it is something we can do at home from over-the-counter products? When should we see when should we seek help for prescription treatments? So I'm curious, I know what I recommend to my patients, and I'm curious what your thoughts are on this, and kind of thoughts on the timeline of the symptoms, and again, over-the-counter vitamins, supplements versus prescription products and prescription treatments. So there's a lot to talk about. Let's try to keep it sort of informal and brief. I know people are busy and don't have much time. We'll try to keep it maybe at half an hour, and we'll leave some time for questions at the end. So I'll hand it over to you.
Well, first of all, thank you for your invitation and this kind words of introduction. Listen, I put my makeup on for you on Sunday, January 2nd. So.
I put some on for you too.
And actually, I think I'm having some symptoms of COVID as well. So I beat you. I'm like fresh in COVID currently.
Oh my goodness.
Yes.
Live from a COVID infected doctor. Here we go. We both need to prepare for what might be coming our way with our hair.
Yes. So I had COVID in 2020 myself. I got the very first version of it in March 2020, and exactly 3 months later, when I just became pregnant with my daughter, I started shedding, and it was so unreal for me, because I know during pregnancy our hair is so gorgeous, it doesn't fall off because of positive impact of hormones, but I was shedding daily for 5 weeks, which I've never faced in my life. And then months later, in our hair loss, hair expert world, we have determined this post-COVID hair loss. There are several types of hair loss that can occur after having COVID. What are the reasons why we lose hair after COVID? Well, number one is stress. I mean, our immune system is just under so much stress, whether we have COVID or we don't, we live in a new reality that is stressful. So that's number one. That definitely depletes our immune resource. Then high fever that comes with COVID, and we know whenever, even if we have fever that is not COVID related, that can cause later on hair loss. Then lack of hair care, during the lockdown, and some people are again in lockdown, you don't have your regular hair care or hair therapy available in your doctor's office. Also, COVID comes with this, I don't want to be too medical, but inflammation of blood vessels that we call vasculitis, that also causes depletion of nutrients to our follicles. And I also think it comes with, change of your lifestyle. You don't exercise as you would normally do. Nutrition probably is not as good as it would be. Your social, relationships are not as good as they would be. And there's really a lot of reason that goes into that hair loss. What we know now, which we don't know whether that's information is going to change in a couple of years, but we know that typically shedding happens, as literature says, 58 days after, on average, 58 days after the onset of COVID. So let's say 8 to 9 weeks. It is type that we doctors call telogen effluvium. One, telogen effluvium. What happens is hairs go into inactive phase of growth simultaneously at the same time, similarly as after childbirth, after any physical or emotional stress, and other causes of telogen effluvium. So what patients see is shedding. Like, I know my patients, they come to the office and they do this all the time, and lots of hairs are coming out. It can happen, it can come with itching and other symptoms on the scalp. Typically the ponytail gets thinner, and what I see in patients is those frontotemporal recessions getting thinner and thinner. I was able to regain my hair, so we'll see what's going to happen with the second wave.
Mm-hmm.
right now of
Fingers
hair.
crossed. Mhm.
Apart from telogen effluvium, I gotta mention there is a rise of alopecia areata type of hair loss after COVID as well. It's just this immune system that operates at the best level. Then in those patients who suffer from alopecia areata or are prone to autoimmune diseases, that triggers the alopecia areata. Also, it can trigger androgenic alopecia as well, or trigger or worsen cicatricial alopecia. So it's not a joke, and it is the most common type of hair loss that I've seen in the past now almost 2 years in my patients.
Mhm.
I've had um,
Well, thank you for that overview. And one thing that I was wondering when you talked about the reasons for hair loss in COVID, one of them was high fever. And I wonder, and I like to remain hopeful that with Omicron, which seems to be milder than the other variant, where we're not seeing fevers as high. I certainly didn't have one. I think mine was up to 37.8, which is not even 100 Fahrenheit. And what I'm hearing from my friends, patients, and acquaintances, they're not getting the high fever with this variant. So I wonder if the post-COVID hair loss, I'm hoping that it won't be as bad if that's one of the triggers for it.
yes, I only had fever one day. That was 2 days ago, and it wasn't that high. What the research has shown is those patients who have had higher fever, they suffered more intense hair loss. So it is correlated, and it dates from Spanish flu. That's when it was depicted in literature for the first time in 1918, when the correlation between high fever and hair loss. And I see it in children a lot. Young children or children, when they have high fever, sometimes might be followed by hair loss a couple of weeks later.
Yes, and we've certainly seen that COVID is not the only virus where we're seeing this. When patients come in after hospitalization for pneumonia or any other surgical procedures, high stress procedures to the body, but certainly those with high fevers, we're seeing the hair loss. So this is not exclusive to COVID.
No, no.
I'm wondering, when you had COVID the first time, you said you lost a lot of hair. Did you have a high fever?
Yes.
Yes. Okay.
Well, it wasn't actually, I take that back. No, it wasn't that high. I had fever on and off. It definitely lasted longer the first time than now. I already feel better. I'm like 3 days out, and I already feel better. But I always now, after all these years in the treatment of hair loss, my research and my clinical experience just led me to understand hair as a part of a larger system, which is our body. So if someone is suffering from hair loss, the problem is never there. It's somewhere within the system, and that's why we need to look at hair loss as a systematic disease or as a symptom of something else happening in the body.
Absolutely.
From the genetics that is there, but there is also genetics that has to be taken into consideration.
Right. And genetics we cannot control, but there are things which we can control. So speaking of which, what is it that we can do to minimize? Is there anything that you think we can do, and the data shows we might be able to do with telogen effluvium? Telogen effluvium minimizing the chance of it happening. And then once it happens, if it does, what do we do to treat it? So what recommendations do you give to your patients?
There is a saying, when I went to medical school in Serbia, which you didn't have a pleasure of doing. One of my
Skip that part a little bit, a few thousand miles away from where you studied.
One of my professors used to say, 2 doctors, 3 different opinions. So I bet you and I now exchange our opinions how to treat telogen effluvium. We're going to come up with completely different solutions. And in reality, there is no one solution to treat telogen effluvium. I think the first question is whether to treat the patient or not. Because in many cases, telogen effluvium resolves on its own. in patients who don't have a history of hair loss, never suffer from telogen effluvium, are generally healthy, you know, don't have anything in their labs that can lead me to think that can be another trigger of telogen effluvium, I would probably say, you know, let's wait for a couple of weeks, let this telogen effluvium takes its course, and it's gonna resolve on its own. But that's a fine line, you know.
Yeah, and it's a very hard conversation to have with our patients because they come in with tears when the hair is shedding and they have half the hair left that they had, and you tell them, well, let's just wait. It's
Yeah,
not what they want to hear, so it's a very, very difficult conversation to have.
it is, and especially in my case, it lasted for 5 weeks. So 5 weeks of daily shedding for me, who you know, I have a lot of hair. It's hard to say, okay, let's sit back and do nothing. Trust me on this, and even take that responsibility is not the easiest thing. But if you have a, you know, a healthy patient, you know, with other characteristics that I just described, I think maybe to give it just a little bit of a time. Then when to start therapy? I don't think that any therapy necessarily can stop it. I think rather it can help regrow hair later. What I personally did, I did take some vitamin supplements. And also when I had my daughter in February this year, I also suffered from hair loss. So another telogen effluvium 3 months later. I don't like anything aggressive on the scalp at the moment of telogen effluvium. My rationale is I see telogen effluvium as an earthquake of the scalp, and I'm concerned that injecting anything in the scalp may worsen the condition at the moment. I would check patients' labs. I want to see if, you know, vitamin D, keratin level, B12, you know, marks of inflammation, everything is, you know, within the range. If I need to correct something there, I would. I would do, you know, I personally take a lot of supplementation myself, and I would probably put patients on this viral antioxidant supplementation such as L-lysine, lemon balm, B12, which I love, vitamin D, zinc. There's some, you know, vitamin minerals, essential acids that are good for health overall. And then I think if I need to decide to put the patient on the therapy, I think my first choice would be laser therapy because it's temporarily used. It's good for 6 to 9 months, which is a perfect timing to regrow hair. It's not aggressive on the scalp, and it's effective.
What type of laser therapy do you use?
Yeah, laser cap, low laser therapy. My concern, I always get a question, you know, doc, I want to do PRP for my hair loss because PRP is such popular therapy. In my eyes, is not, and this is something, you know, we might not agree on. I'm going to share my experience and my concerns rather. It really depends what PRP system is used, because it depends on how pure that PRP is, because sometimes in less expensive systems, it comes with a lot of pro-inflammatory factors. And when you inject something that contains pro-inflammatory elements into that burning scalp, that can worsen the condition. But that's a minor concern. Much greater concern is, as we know at this point, that there is hypercoagulation in your body due to COVID. We're injecting platelets into your body. You know, that's why I said, you know, PRP, it's not the greatest therapy after COVID. So I'm very concerned and conservative when it comes to PRP therapy. Also, there is lotions. There is, you know, minoxidil and other compounding lotions. Minoxidil also can worsen hair loss if you, you know, if you are in the group of those who have bad reaction on minoxidil. That's why I'm like not really confident about that, but it definitely can be used. In my case, I use supplements, and I did laser both times that I lost hair after my daughter after my daughter was born and after COVID. And that's my plan. Actually, I'm gonna do it again after this COVID.
Okay, so you will start that stuff preventatively. I do want to ask you a question about supplements, but just before I forget, I agree with you about the PRP and the concern with platelets. That was the first thing that would come to my mind. So it's not something I recommend to patients. The role of intra-lesional steroids is, I think, controversial. I just don't think we have enough studies to really know whether it's the right thing to do. Like you said, the telogen effluvium, which is this acute hair loss that can happen from COVID and other stressful reasons, is like an earthquake of the scalp. So you would think if you inject cortisone, it might help calm down the earthquake a little bit, but then there's the concern that there's so much inflammation and shock going on in the scalp that now you're going in and poking the scalp with injections. You are injecting cortisone though too. So, you know, I do sometimes do that. I've done it for a few patients preventatively who have a history of telogen effluvium with their pregnancies and with changing medications. And then they come in and, you know, I had maybe 2 or 3 that had COVID, and they said, I know it's going to happen to me. Can you please inject the cortisone? And I did for 1 or 2 patients preventatively. It's hard to know whether it minimized it. They didn't have much hair loss. Maybe they wouldn't have had it anyways because it's a milder variant. Who knows? I'm hoping that COVID is getting milder as we go along. But it's hard to know, but it is something that I offer to my patients because it does get very heartbreaking to not be able to do anything. And I don't think it's something that could potentially harm. It may, and I tell them it may or may not help. It may or may not make a difference. With PRP, I would be much more cautious because of those platelets and the hypercoagulable state. The other interesting ingredient is spironolactone. So there is some data that shows that taking oral spironolactone may actually help with COVID in general, not just with COVID hair loss. And as you know, we use spironolactone as an oral treatment for hair loss, especially in the setting of hormonal changes with PCOS, polycystic ovarian syndrome. And I wonder if topical spironolactone, which I do use with my patients in conjunction with minoxidil, if that might be something that would be helpful.
Yeah, I agree with you. Spironolactone is great. And also it's great as oral therapy. It's anti-androgen, basically. And now we know the research has shown that patients who have been prior to COVID on some anti-androgen therapy had minor symptoms of COVID. So there is this interplay of androgen and COVID in this game of this disease. So anti-androgen therapy is great. So we have dutasteride, we have finasteride, and spironolactone as anti-androgen, and there is a new medication called bicalutamide, which is a new anti-androgen. You have to be cautious, you know, because premenopausal women cannot be taking those. Finasteride and dutasteride cannot be used in women that have a history of breast cancer. So other, you know, medical history must be taken. I love spironolactone in the form of gel. I think it's a great therapy, and it makes so much sense to use it after COVID in, you know, certain patients.
Absolutely. So let's just touch on vitamins a little bit. You mentioned a few. I do get the question a lot from patients about, should I use Viviscal? Should I use Nutrafol? Should I use biotin? What's the right one to use? What are your thoughts on these supplements?
I think the right supplement is the one you lack at the moment. So that's your best supplement. So first take the labs and see if there is anything missing out there, and that what you need to supplement. Then there is this universal scarcity of vitamin D in most of patients, because a lot of people, you know, have low levels of vitamin D, and that's one of the most important vitamins, not just for hair, but also for our every cell of our body. I actually brought my list of vitamins and supplements, just not to forget what I'm taking and what I'm going to be taking after this COVID has gone from my body.
That looks like a long list. Please do share.
You know me. In reality, we as much as healthy as we eat, I mean, we have to be really focused to take in everything we need in a right amount to be balanced in what our body needs of the supplement. So sometimes it's easier to take them as a good supplement rather than to take certain amount of food to bring enough into your body. So what are my favorites? So now as I have COVID, my favorite is L-lysine, that essential amino acid, and it actually slows down viral replication, potentially. These are all supplements. So research out there available is, there is not a lot. Then I like lemon balm, which also has antiviral properties. I like zinc, vitamin D, and I typically use vitamin D with K2, the combination of the two. I like B12 as well. It helps maintain your iron level in the body. What else do I like? That's, I think, pretty much I take every day. I take sometimes melatonin before going to bed. I have 2 small kids, and my sleep is pretty much interrupted. I also have a husband who snores, so if my kids don't wake me up, he will. Take melatonin to sleep, and there's remarkable research out there that melatonin helps with hair loss.
And it's a potent antioxidant. I just learned that recently. I never thought of it as an antioxidant. It's actually used in skincare now as well as a topical antioxidant, but taken orally as well. It has similar benefits.
We can also compound it in a lotion. I love compounding melatonin with minoxidil, with vitamin D as a compounding. I compound around 70 ingredients. I can combine them in lotion. So melatonin is, must have and must be in. So I love melatonin. I think melatonin is great. And also, once we see in the lab that someone is missing one of the supplementation, we supplement that right away. There is a lot of, hair loss industry is so big, as you know, as skin industry. I don't know how you can do skinimalism with so many available products out there. And the same thing is with hair. I mean, there's if I'm an average buyer, you don't know what to buy. 2 supplements are very, very popular. One is Nutrafol and the other one is Viviscal. I would say these are the 2 most popular ones. Nutrafol is not available in Serbia. For those who are watching, Viviscal is. They're both amazing. What I like about them is they're completely natural. They contain ingredients that make sense to be used for hair. They're upscale, basically, hair vitamins. So the question is when to use which. And to answer, to continue on your thought on spironolactone, what's interesting about Nutrafol has saw palmetto, which is also a mild anti-androgen, as we know. So that can be potentially used after COVID, and also has ashwagandha, which helps you sleep better and relaxes you. So that's sort of sedative, like chill out vitamin. But on the other hand, Viviscal has has this aminomar complex from deep sea protein, has zinc, has vitamin C, has biotin, and everything, and every other, you know, good mineral or vitamin for hair. So they're both evenly good.
Mm-hmm. Okay. We just received one question before we continue talking about the supplements. I don't want to forget the lotion that you mentioned. A few people asked where they can get this lotion. Can you touch a little bit on whether this is available both in the US, whether you prescribe it both in the US and in Serbia?
You have
lotions.
Yeah, compounding lotion is, you can get it at specialized compounding pharmacies. I work with one in Serbia, one particular in Belgrade. I make personalized prescription for every patient of mine, and based on what I think it's best for them, for that patient specifically, that's how I make the lotion. I'm sure there is compounding pharmacists in New York that you can write prescription to your patients. It's just a matter of what is compounded. Why I started this is because I was so annoyed with propylene glycol in minoxidil, because that's the basis where minoxidil is dissolved, and that's what is, as you know, irritating patients' scalp, and that's why they most likely shed. And I was looking for a bit better dissolving base for the lotions, and that's how I found this natural base in one of the pharmacies in Belgrade, and now in Miami, where I also practice, that we do not have patients use minoxidil dissolved in propylene glycol.
So to summarize the answer to that question, you do need to see a physician. So I prescribe it as well. We work with a pharmacy called Hairstim, where we compound minoxidil with spironolactone, dutasteride, finasteride. So there's a few different ones, and they're not all great quality. So you have to know which physician kind of to go to. And both Dr. Kuka and I work with pharmacies that do not use propylene glycol. So propylene glycol is an ingredient, an inactive ingredient that's used in the vehicle for these lotions, which is found in a lot of over-the-counter versions of minoxidil or Rogaine, that seems to be the most irritating ingredient that causes people to actually shed initially when they're using minoxidil. So the formulation is very important. It's not just about the active ingredient, it's very much about the inactive. And these typically have to be prescribed by a physician who specializes in hair loss. So for the New York area, I'm happy to see, and my partners, Dr. Banusali and Dr. Mian, who also specialize in hair loss, we prescribe this. Dr. Kuka does it in Florida as well as in Serbia, but it is something that is available only by prescription.
Yeah, and I mentioned to what you're saying, there is this art of compounding. So a very important link in this chain is your pharmacist, who knows how to compound, who knows what is going to dissolve in what, and who knows to obtain the same doses every time for your patient, you know, not to make variation in doses in the same lotion. So you really need to find, I'm glad you have one, because I'm thrilled with mine in Serbia. Just she knows what she's doing, and that's very, very important for the patients to get the real stuff.
Absolutely. And we have one more question about, the question was about brand of supplements, and I think you already mentioned mainly the Nutrafol and the Viviscal. Can you explain your routine? Is it better to take it in the morning before food? Does it matter what time of the day it's taken? Supplements, it probably depends on the supplement too. You mentioned a few.
Yes, well, I'm taking a lot of them. It is important what kind of supplement is taking, because a lot of them do not contain active amount of ingredient. For example, zinc. There are so many forms of zinc. However, zinc sulfate is the best form of zinc that body can benefit from. So I like zinc sulfate. I like, if I can mention the brand, I use Vimergy brand. I use it as a lotion, as a in a liquid form. Also, those gels, those pills that are in gelatin pills, if they're of an animal origin, they're not the best supplements you can get out there. So there is a long story about the supplementation that could be a topic of a different life.
And one interesting thing about vitamin D that I didn't want to forget to mention, I just read that, you know, everybody is talking about, you got to take, if you have COVID, you have to take vitamin D. And what does it have to do with vitamin D and sun exposure? Why is it so important? And I just learned by reading a study while I had COVID is that it competitively binds to these ACE receptors that COVID binds to in our organs. So it's kind of like the competitor to COVID. COVID is trying to get to your organs. You take vitamin D, it's going to those receptors and not allowing COVID to bind.
Yeah.
But it's very interesting. So I was taking, I think the general recommendation is about 25,000 units a week. So I was taking 4,000 units a day. I took vitamin C as well, as at least 1 gram in a supplement form. Zinc makes me a little bit nauseous when I take it. So maybe I wasn't taking the right form, but and maybe I was taking it on an empty stomach. You kind of lose sight of things when you're sick. You just you don't think about when you're taking it. You just take things when you remember. So vitamin C, vitamin D. I was taking iron because I have iron deficiency. And the other one that I read about is N-acetylcysteine. I don't know if you're familiar with that one. There were some studies that showed that it might decrease, it's a potent antioxidant, that it might decrease the chance of COVID spreading from the upper respiratory to the lower respiratory tract and to the lungs. It might decrease the chance of pneumonia and hospitalization. So I took 1 tablet twice a day for a week while I had COVID, just based on that data that I was aware of.
I forgot to mention it. It is a great supplement. And also quercetin. Quercetin enables zinc to enter the cell. So it basically enhances the effect of zinc. One thing about vitamin D, it's better to take it in the morning or close to a morning, because in the night it can interfere with your natural level of melatonin in your body. So it can mess up with your sleep. So better to take it in the mornings or closer in the morning. If I'm to choose one protective vitamin for myself, that'll be vitamin D. Like I would give it a better spot than vitamin C, which is traditionally known as a omnipotent vitamin. But I think vitamin D is so essential, and the best way to get it is go outside and spend some time on the sun. But you know, that's not something that we all practice. But to get it, you know, from your skin when it's mobilized into your body is also great. And also, what is important to have good vitamin D level in your body is that your liver is cleansed in a right way, so that you detoxify on a regular basis. So it's not just how you eat, it's also how you and how often you detoxify your body.
So I think what I'll do, I'm receiving a lot of questions about, to repeat the names of some of these antioxidants. They're very long, complicated names. What I'm going to do, and I took notes as I discussed all this with you, Dr. Kuka, is when we post this Instagram live on our feeds, I'm going to kind of summarize all the recommendations that we came up with. And we'll write down the names of all those supplements and vitamins so that it's easier for people to refer back to.
This is not a treatment of COVID. This is just enhancing your body and taking the right supplement and helping your hair grow after you have had COVID. You know, we know what's, you know, conventional therapy for COVID. Just this is what you can do at home to help yourself.
Absolutely, yes. Thank you for clarifying that. The treatment is different. So it depends on, it's different for everybody. It depends on the severity of your symptoms. I had to take antibiotics because my symptoms worsened on day 7. I had to take oral steroids. I'm actually still tapering down the steroids because it was starting to affect my lungs. I was getting bronchitis and it was very uncomfortable. So these are treatments that are going to be tailored by your physician. We're here talking about what can we do to help our immune system be stronger in fighting off the virus and also fighting the post-COVID sequela, hair loss being one of them.
Yeah.
Dr. Kuka, thank you so much. Is there anything else you wanted to add before we end? I'll summarize all of this in our post for everybody to be able to review easily.
No, I just want to thank everyone for watching, and I wish them to take good care of themselves in the upcoming 2022. 22 is a good number. And you know, the better care you take. I used to tell my patient, whatever you do for yourself every day, even for 5 minutes, is better than whatever you do like occasionally, even longer time. So make your decision to do something for yourself and your health daily. Make a new daily routine that's going to help and enhance your body in the upcoming year. And hopefully at the end of this year, we're not going to be talking about COVID anymore. We're not going to be socially distanced anymore. And we're going to get our life back to normal.
Thank you, Dr. Kuka. And I wish you a speedy recovery from your second COVID. Happy New Year to everybody. Stay healthy. And I look forward to our next discussion. Feel free to message either of us, or when we post this, just drop your comments on what else you would like to hear the two of us discuss. Between me being a dermatologist and Dr. Kuka being a plastic surgeon and a hair restoration surgeon, we're happy to do one of these again for you. All the best. Happy 22.
Thank you. Bye-bye.
Bye-bye.